Hello everyone, and welcome to Physio Trendz. I'm Dr. Prem Shah, and yes, I know it has been long that live sessions has been conducted for Physio Trendz, but today we are going to discuss about MPT and all the questions what you have about MPT specialization. So what I have thought about is in this live session, I'm going to talk about let's say first of all, first criteria is why to do MPT and whether you should do MPT compulsory after BPT or not. That is the first thing. Second question which I am going to answer in today's class is, okay, if you are doing MPT, then which specialization has a huge scope in future, considering 2025 right now. And third topic which I'm going to discuss about is, other than MPT, which all things can be done after BPT and what is the scope of that after physiotherapy, after doing physiotherapy. So I'll be starting with these three things in the live session. Apart from this, if you have any questions, you can let me know in the comment sections. I will be reading out loud your comments or questions, and then I'll be answering them one by one. So without delaying it, let's start. That first thing is whether you should do MPT and why you should do MPT. So guys, MPT, yes, you have to do, you should do. That is what my opinion is about. And why you have to do it, because current scenario, looking at the competitions what we have, first factor is that like, because if you are not doing MPT, you are of many people who have just completed physiotherapy, and you will have very less opportunity and chances. So that is the first thing. Second thing is, if you do any specialization, then you can grow in that particular specialty of physiotherapy, which will help you to discover like your growth factor, as well as what all extra things you can do. And also you can target one population for your future reference. So that is the second thing. Third thing is, if you are someone who is looking for a future in healthcare or physiotherapy, may it be in academics, or let's say it is like you want to study further, like you want to go in research or something like that, still MPT will be required. And most importantly, apart from all these things, you are someone who wish to work for someone or start your own setup. If you are MPT, definitely your patients will have better trust, more trust on you in compared to just having a BPT degree. I know many of the people are already like putting their name tags like uh, person XYZ, BPT, then MIAP, then some or the other memberships and all, and they try to make it look bigger. But now I would say that patients are not that dumb. They know what all things are going on, what is MIAP, and what's your skills and knowledge. So if you're really looking into like, yeah, I want to improve my skills, I want to gain some knowledge, detailed knowledge in a specialized field, then yes, you should obviously go for the MPT degree, master's degree in physiotherapy. So I hope this clears the basic most question what all of you guys have when you connect with me and when you want to ask me this question. So MPT, yes, I would say that suggested, you have to do it. Now, second question, what normally commonly I get asked about is, if I'm doing MPT, then what specialization is the best one, and why should I go for this specialization? Now, guys, we know that this MPT specialization, like very commonly, we talk about like MSK, sports, neuro, cardio. And sometimes, if you are like more interested in pediatrics, yes, some people go in pediatrics. So these are the like basic most popular specialization what people wants to go in after completing BPT. So specialty wise, yes, first factor is that what you like, that you do it. Yes. Second factor is what do you see in that particular field, specifically, like okay, in future after 4 to 5 years, how this field will look like. Let's say that I'm doing in MSK specialization. After 5 years or after 3 years of my completing master's degree, will there be more and more demands of MSK physical therapist or physiotherapist? Will there be more and more demand of sports physiotherapist, or there will be some other specialization which will be in more demand? That is what you have to look for. So if you consider these two things, first thing is your interest, second thing is okay, all right, now what is the future in this specialization looks like. So if you just decide your specialization on the basis of these two things, then definitely you will choose wisely, you will have a better clarity that why you should do this specialization, other than just blindly following that okay, my friend is doing sports physiotherapy, so I will also do sports. My friend is doing MSK, so I will also do MSK. No, that is not how you choose your specialization. That's the second thing. uh, the third thing, now the most important thing is, according to me, what specializations will look good in next 3 to 5 years. So I what I see, like I'll just explain you how I think and why do I think that these specializations are going to be like most popular and most important in terms of awareness wise, in terms of earning wise, as well as I would say that opportunity wise. So first factor would be, or first specialization would be, I will go for women's health, or you can consider like women's health or OBG gynec, something related to women's health. Why I think like this is because already there is very good awareness about women's health. More and more females are more aware about their bodies and the changes they get stages wise. It is not anywhere just related to antenatal and postnatal only, it is more than that. Because right now, because of the lifestyle modifications, what all changes are happening, and the awareness as well as the opportunities what we have in this particular segment is going to be very 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 vast. And especially if you are somebody who is a female physiotherapist. And one more perspective is like if you're looking for a safer option, or you want to go for like okay, you want to start something of your own specialization, and just because you have advantage already of being a woman, and if you're doing specialization in women's health or OBG gynec, you will have more and more opportunity if you create something of your uniqueness in that particular specialization. We can talk about it more. If you have any doubts in this, you can put it in the comment section. Second specialty, according to me, what I feel is going to be the very good popular in the next coming years is geriatrics. Again, it comes under the rehabilitation only, but again, yeah, I feel that the way the number of population growing, as well as if you take out the data of all the countries, you consider Western countries or Eastern countries, Asian countries, you will see that number of elderly population is increasing. And also we know that the physiotherapy related conditions what we normally treat are also more and more being seen in elderly population. So they are the ones who are going to require most physiotherapy treatments in the future, and they will be needing that. And for that also, most of the governments are working to provide them best of the healthcare facilities, and physiotherapists are the number one priority in that. So if you are somebody who has specialized in geriatric healthcare, and who can help the elderly population, again, very good scope can be there in the future era. Now many of you guys will be thinking that most popular ones what we have heard is like MSK, sports, cardio, neuro, and you are not even talking about it. So why I'm not talking about it is because as I started my live session and I told you all that I'm just going to mention about the few specialization according to me which can be like a very good in future. That is why I've started with this two specialization. All right. Um, all right. So let me see if you have any questions over here, and I will be continuing with the more two specializations what I think are going to be more popular in future, let's say 2030, 2029 or something like that. So Manindra Babu, hi. Sublakshmi, hi. PhysioFit Healthcare. Yeah, it's really nice to see you also here. Punita, hi. And Ansh asked me that just completed my final year, currently an intern, and I'm now looking forward to prepare for NPT. Is it a good option? Yes, Ansh, of course it's a good option. Why I'm saying this is because if you want to apply for NPT, there are different rules, by the way. Yes, before it was like after BPT you can apply for NPT, but right now they have mandated DPT compulsory. So you first look into that particular rule in the FSBPT website, and after that you just dive into this. But according to me, as far as my knowledge, DPT is mandatory to apply for FSBPT, and then you can apply for NPTE exam. So just make sure that you clear all the FCCPT, FSBPT paperwork before planning all these things. Second question is, sir, I'm 25 years old. I want to do PG in sports. Does age factor matter in physio field? Himakshi, doesn't matter much about the age factor as far as you are yourself are really in good fitness as well as health, because your if your goal is to be on field physiotherapist, then it's not just like okay, your athlete is going to come, you're going to treat them for patella tendonitis or hamstring strain, and you're just going to treat them for certain conditions in the clinic based. You're going to be on field. So if you yourself are maintaining fitness, if you yourself think that yes, I'm able to cope up with the on field physiotherapy work because it's going to be hectic, then definitely you can just go for it. Don't think about the age factor, it really doesn't matter much. Hello Preeti, hello Regan. MPT in MSK. Definitely, I'm going to discuss about this, Regan, in just few minutes. Can an MSK PG go into sports field and additional course required for it? Well, nowadays, just because of the popularity of sports physiotherapy, and I would say that lack of opportunities as well, I would not say that just blindly go for the sports physiotherapy, because you all also know that what is the reality. Like every person who is doing MPT in sports are not getting opportunity to work on field directly, and that too if you're looking for like countries like our India, where we have maximum popularity for cricket sport. And in that also, if you are going up to some level, then only your payment or something is like at a respectable amount. Other than that, if you're going to any other sports, even if you're going for national sports events, uh, I know that the pay is not that great. And yes, I'm not trying to demotivate anyone over here. It's just the reality that we should be aware of, that everybody is not getting chance to be a sports physiotherapist for Virat Kohli or Indian cricket team. There are other sports, and all the sports don't have a proper budget for physiotherapy services yet in our country. If you are yes looking for to work in a sports field in some other country, and for that MSK degree will not be valid, you will have to take a specialized course in sports physiotherapy and specific to those countries only, and after that you might get some opportunities to work on the field. um, the next question, yeah, distance MPT learning, the this is like something a black mark for our field. I know that many of the senior physios as well as good physios only are doing it or promoting it, and I'm not recommending to go for any kind of those things, because that is not some way you are going to gain any knowledge. or you're going to get any benefit of that degree. Yeah, it's just for the namesake. If you're going to do it, it's your choice, but it's not recommended. All right, first year BPT, Bhumeshka, I am going to explain you, buddy. Just wait for a few minutes, because now it's time that I'll just tell you about like more to specialization. Because first I already told you about women's health, OBGYN, as well as geriatric. Now, which other two? Anybody has any ideas? Like, what do you think? Like, which other two specialization in physiotherapy can be uh, a very futuristic, if you consider 2030, 2035? Like after 5 years, after 10 years, what do you think in physiotherapy? Which specialization can be something very special? If you have any ideas, just put it down, and I'll start with something of what I think about it. Okay. So third thing, what I think is some specialization in pediatric sports. Guys, I know that you will think like sports physiotherapy means it is going to cover up everything, like it is pediatric also, adult also, everyone. But there are some courses like specialized in pediatric sports. Now, why I am insisting on this is because even if you're doing MPT in sports, I would suggest you that you take your thesis in pediatric related sports injuries so that you can work in pediatric sports center. Because as the time goes, again, the more and more awareness is there in sports field, especially for the children who are like at the age of 5 years, 6 years, or between 5 to 12 years basically. And as we have studied anatomy, physiology, we know that the functioning of the body is completely at different level in compared to the adult athletes. So if you are someone who is having deep knowledge about, okay, pediatric candidates in sports injuries, like for example, let me tell you about, like, okay, you must have heard about the Osgood sclerosis disease. So it is a condition which you will find in the pediatric sports people, like especially the children who are into jumping and running activities. And for them, we will see that they will get some anterior knee pain, especially when they are running or jumping. So, like these conditions, as well as how they can grow their sports skills, everything in specific to just pediatric sector. If you're doing some specialization in that particular area, that is going to have a lots of opportunities in future. So that also you can think of when you are planning your MPT. May it be in any country, it doesn't matter, India or any other countries. All right, so somebody is here. I got specialization, Himakshi, in rehabilitation in SV Nizar. Good. That's a good college. But my interest is in sports or MSK. What should I do, sir? Well, already you have got a degree in rehabilitation. Your interest is in sports and MSK. Then what were you thinking when you took the admission? That's my question to you. But anyways, if you have already completed your master's degree, I would now suggest you that you can start looking for some on-field experience or work what you can get in the sports field or MSK field. And once you see that, okay, now you're getting some work or you're getting some opportunities over there, you can do some specialized courses from Indian universities or foreign universities, or you can do some fellowship courses for 3 months, 6 months. If you want to know more about it, I have already posted 3 4 videos about it on my YouTube channel itself. You will find out like what else fellowship courses are there specific to sports and MSK being done in India specifically. So you can just join them, and mind you, they are not online courses, they are all offline courses. So you have to be there for at least 3 to 6 months. You can do those fellowship courses, and then you can work in this field of sports. So that's something you might just do it. Pediatric women's health, yeah. All right, see, pretty, yes, it's being innovative. That's good, because as I was mentioning already, that pediatric is something which is the area where more focus is being given by parents right now. More awareness is there, so you can just go for the sports as well as you can go for the women's health. Very good, very good, because you are combining over here the first opportunity, which is already awareness is good in the women's health. Definitely that is also going to work for you, as well as this pediatric part is also going to work for you. What is the responsibility of band 3 physical therapy? Now you're asking me, buddy, about maybe UK. They have band system different difference wise, and that you can just find it out on the website, or just give me a minute. NHS website, yeah. So NHS website, you will find out the band wise distribution of the work of the physical therapist, and what all things, duties and roles comes under them, and what all requirements are there for that. But as far as I know, band 6 is the starting for the physiotherapist to work over there if you have a bachelor's degree or master's degree. So band 3 and all, I don't know like how does it work out, because band 6 is where you can start. Somebody's telling, yes, visceral organ. Good, Dr. Preeti Bhatia. Yes, that's also something which might be a future. Visceral organ release, but again, yeah, you whatever you are thinking about has to be backed by evidence also. Don't just blindly follow it because you are seeing it now. Okay, it's working for some people, because you cannot just judge it on the basis of what is working right now. You have to think about whether it is going to be, there are going to be opportunities in that particular area or not, or people are more aware about it or not, because and it should also not be invasive or something which is going to harm our patients. So these are the few factors we have to keep in our mind when we are just thinking about it. Sir, one of my senior doing his regular MPT, where he only be needs to give the exam, no need to go to college. Is it even possible? So that is not a regular MPT, buddy. That's called distance MPT. Nobody tells you on face that this is your distance, and because nowhere actually right now currently distance MPT is a valid course. So what they get is, you take an admission, you don't come to college, that's fine. That's the, what do you say, the negative thing, or the advantage given by the college to you. We all know about it that it is illegal, but still it's happening. And that's why I say it's a distance learning, not a regular course. So don't just think about like it's a regular course. So you're coming to Nitte Physiotherapy College? No, I've been there. I'm alumni of Nitte Physiotherapy College, but not coming any in any near time. I have no plans right now. Barrel Academy is very good into it, and anatomy trains. Okay, thanks for giving the knowledge, Dr. Preeti. Uh, even I didn't know about this, but yeah, thank you so much for putting out over here so that many of the people will get benefit of this. All right, let's just continue with this session, guys. You keep on posting your questions. I don't mind them answering anytime. But yes, because so many people have already inquired for MPT, what to do, and why not to do all these things. I'm just going to just tell you all first, and in between, whatever questions comes up, I'll be answering them. Now, this four fields, what I have already told you all, specializations, are futuristic. Like if you are starting your MPT right now, they are going to help you in future. Apart from this, guys, the basic ones, what we do in MSK, sports, neuro, or let's say cardio, these are obviously going to be good. I'm not saying that this field are going to be like fader, because these are like evergreen lines. Their awareness is already present. People already know that if I have a back pain, I should go to a physiotherapist. If somebody gets stroke, definitely a surgeon or doctor is going to refer them to the physiotherapist for their further treatment. So, and if somebody is in ICU, definitely physiotherapist is required to maintain their health, lung health, as well as their bed mobility, everything. So those fields are not going to get fade away. But if you're someone who is like, okay, I want to do something different, I want to try something different, then yes, these options are there which you can just think about. Now, I also get asked that, sir, in our particular university or our particular state, we don't have these specializations. What should we do? Then, obviously, if you just find out that other states there are certain specialization, and that university is affiliated and it's having good exposure of patients in that particular area, it's always good to move out of your state. I'm not saying that you have to stick to your state only. So that is the option what you can just think about. Second thing is, if you think, okay, let's say I was talking about pediatrics, or I was talking about women's health, let's say. So some states like Maharashtra, they don't have a specialty in women's health specific to that. But what you can do is, you can do your masters in rehabilitation. And then, as I mentioned about the sports, like you take MPT in sports, but do your thesis work, like just motivate or talk to your guide that I want to do specialized sports specific to pediatric, or in rehabilitation I want to be specific to the women's health. And do your study, do your thesis work in that particular selected area, and then just move ahead with that. So that is a second way. Even though your state is not having that specialty, you can take help of this rehabilitation specialty, or you can take help of the other specialty to go in that particular way, because ultimately it is about like how you what you do in that 2 years of course, whether which thesis work you are working, which topic you are selecting. So that also matters a lot. So think in that direction as well. So some colleges offering combined sports and ortho MPT. Yes, there are a few colleges. Like if I talk about myself, I have done my masters in MSK as well as in sports injuries. So that was a dual degree I got that time. But right now, that university itself is not providing the dual degree. They have distinguished it. So it depends from your course university. It's just like your university has to be valid, and it has to be like properly affiliated. So there is a special question related to physiotherapy and importance of rehabilitation, if I can ask about it. Of course, you can ask about it. If you're a physiotherapist, you already know that how a rehabilitation is important in any cases, may it be post-operative, or it is pre-operative, or it is for elderly population, or it is for like a normal person. Because we basically are movement specialists, we are movement scientists who basically work for the movements of a person. So anywhere if there is disturbances in the movements, anywhere there is lack of movement, physiotherapists are the ones with the knowledge of their anatomy as well as biomechanics and conditions, who are going to treat them with certain movements, exercises, as well as lifestyle modifications. So yes, there is a lot of importance of physiotherapy in any kind of rehabilitation you talk about, may it be ortho, cardio, sports, neuro, pediatric, women's health, any particular conditions. Okay, how to get MPT papers? Come on, guys, don't spoil this, like, because uh, don't just study for your exams, study for what you want to learn. Okay, that should be your goal. And MPT papers, you can get it from online anyway. You just have to type on Google, you want MPT question papers for this particular university, and right now it's very easy to get them. So just go for that. Opening a clinic, what is the paperwork and permission did we need? All right, so opening a clinic, basic requirement is your degree as well as registration of yourself with a state council, whichever state you want to start your clinic. And if you are starting your own company, then you have to register that company as well. You have to do some gumasta dara, if I'm just telling the specific word. That is what you do it, land registration, or if you are taking a rental agreement, so rental agreement is enough, and you can start your own clinic. These are the basic most things required for starting your clinic. Apart from that, fire safety and everything, you can just do it along with the starting of the clinic. All right. In India, especially from orthopedic surgeons, they don't send patients for post-op physiotherapy. I have encountered persons coming to our clinic after 1 year of post-op. Well, this is not only orthopedic surgeons to be blamed for. We can also blame some of the patients as well, because right now we are not in an era that we have to be reliable only and only on the orthopedic surgeons. We can create the awareness by our own selves also, because if you just know about it, physiotherapists are eligible to directly consult patients. Okay, so we don't need any reference specifically. Patients coming late to you, it's also a patient's fault or patient's problem, because they are not actually working, or they are not taking the steps for their own health. So it's a two-way street. You don't always blame the orthopedic surgeons, it's also patients to be blamed from, as well as I would say that sometimes therapists to be blamed for, because physios, if a patient comes to them, if we are not providing them proper education related to their conditions, then somewhere even we are making mistakes of making them understanding like what their condition is, and how long the rehabilitation will work and what all phases it will go. So we have to explain to them, and then definitely patient is going to uh, be compliant to the treatment protocol, and they are going to get benefit. Even physiotherapist is going to get benefit. Okay, now we are completely shifting from MPT to earning potential 20-30K practically without any home visit. It is impossible to earn more, all right? I'm not going to deny this fact. I know that this is reality. But as I was mentioning, we have to look, if you are looking from the future perspective, which is why I have started this live session. If you are going to do your MPT specialization, let's do something new and creative so that you have better opportunities to create, as well as the earning potential is more. So that is all this live session about. Also, they visit us after 1 year and having restricted range of motion. Patients are not having knowledge. Yeah, it's both the way. I'm not just saying that orthopedicians are not to be blamed for. They are also to be blamed for. And if they are not, let's say, referring also, right now due to social media, as well as basic understanding of the people population is at certain level, that they know that okay, they have to do certain physiotherapy or movements. So that factor also we have to keep in mind, and we have to make sure that we are raising awareness from our side as much as possible. I have done BPT and working cancer hospital since 2014. That's great till today, but now I have to move abroad, but confused where I should go, Gulf or UK. My wife is also physiotherapist. Go to move at 40 age. Well, Mr. Rakib, it's like anytime you want to move, it's always a good plan. I'm not denying the fact. But the only thing is you have to make sure that wherever you are moving, you have already like clarified what all opportunities you are going to get, as well as you have to just go through a thorough, I would say budget this thing planning. It should not be like okay, you're just going from there thinking about the earning potential, but you are not thinking about the spending potential also. Because recently I posted a video about United Kingdom, like what are problems actually physiotherapists are facing over there, even though they are HCPC registered. Jobs are not there, very few people are getting jobs in NHS. And if you're not getting in NHS, then your pay scale is low, then that means you're just basically surviving over there, you're not saving much money, like lots of things are there. So just if you have figured out all those things, then there is no harm in moving out at any point of view. Okay. And as you mentioned, you have started working after BPT, that means you have not done any specialization also. So think about those things as well, because specialization might be a requirement when you are going to any foreign countries. What are the degrees specifically required for sports physiotherapy in foreign countries? US, there is no MPT for sports physiotherapy. It's like masters in kinesiology, etc. How to choose degree subject? Yes. So specific to USA, if you talk about, they don't have any specifically sports injuries master's degree. They have kinesiology, they have exercise science. And here the main important thing is, for USA, anybody who wants to practice in physiotherapy, they have to clear NPTE, a National Physical Therapy Examination. So once you do that, after that, you have specialized examinations specific to like MSK population, geriatric population, cardio, neuro, which are again the higher levels of exams which you can give after clearing your NPTE. So that gives you that specialization touch along with your knowledge. So here in USA, it's not about your degrees, it's about your knowledge. So that's a difference over there. I saw so many orthopedic doctor prescribe SWD, IFT. Okay, that's a common problem. I know that. That's like, we cannot stop them, but we can just make sure that we are doing our best from our side. We are explaining our patients the best thing, educating our patients the best thing, and if possible, we try to understand as well as explain to our orthopedicians who are referring the patient that this is not the way it works. If they understand, it's good. Not understanding, we just have to forget about them and we just have to keep doing the good work from our side. All right, sir, can we go for MHA after BPT? Yes, of course. MHA, MPH are good courses if you just keep in consideration like Masters in Healthcare Administration as well as Masters in Public Health. And for that also I have made a video on my channel with my wife who has done MHA after BPT, and so all the things like comparison we have done in that video, like after BPT MPT as well as after BPT MHA, because I am MPT, she is MHA, so we have like differentiated both the things, and you can just watch all the differences in that particular specific video. Which degree other than MPT? So as I was mentioning already, MH and PH is already there. Apart from that, if you look at it at like futuristic, recently I was just going through certain courses which are being offered by good universities like Harvard, MIT, or even in India, I guess there are a few courses available which are specific to AI in healthcare. So those are some good options which we can think of. If you are tech savvy, you like to be surrounded by technology, and you know the opportunities and scope in artificial intelligence. So if you can learn something different in healthcare, I think you can take up those courses. Those courses are not for free. They are charging somewhere around 3,000 to $3,500. So again, if you are ready to spend that much for 6 weeks, 10 weeks courses and build your career in that particular area, those are good options. Mm, you should hire a good video editor which will promote your videos. Thank you so much for this advice, but as I've already said, like I have already talked about it, my channel Physio Trendz is all about making sure that the future generation of physiotherapists are having certain backup, or I would say guidance, which some or the other way I could not get before 10 years when I was starting my journey as a physiotherapist after my master's degree. So this is purely dedicated to students who need some career guidance. I know that definitely if I have good editing as well as good promotion of my videos, I will be able to reach more and more people. But I'm just right now not in a position to go into those details right now. So I'm just focusing on the basic things like, okay, how can I help you guys? And if my purpose is being solved, I know that you guys are going to help me to get these videos to more and more people. So, but still, thank you so much for that suggestion. Exercise physiology. So exercise physiology is nothing but if you have studied master's degree in sports, one book is there, Wilmore. Okay, so you just go through them, or Wilmore, as well as I would say there is one more book. Oh, I forgot the name. Okay, if I remember, I'll just put it in the description. Right now, I'm not able to remember Kareem Khan. So these two books are there, which have very nicely explained about the exercise physiology. Uh, Plus, I have also made a full short video series about exercise physiology. So I would recommend you to just go through that. You will get the basic idea about the exercise physiology, and definitely if you want to go in details, I would suggest you to read books. भाई पाकिस्तान से हो डीपीटी की हाँ किया है ना कोई फ्यूचर दिख रहा है फॉरेन जाओ और क्या करो भाई again, it's all about how you are looking at it, what all plans you have, goals कैसा है आपके, उसके ऊपर सब कुछ डिपेंड करता है। तो फॉरेन जाना तो ऑब्वियसली बेटर ऑप्शन है ही है, मैं ऐसे उसमें मना नहीं कर रहा आपको। पर अगर आपके ऑप्शन में ऐसा नहीं है कि फॉरेन नहीं जाना है, तो उसका मतलब ये नहीं कि आपके पास कोई करियर नहीं बचेगा, आप कुछ और भी कर सकते हो। आपको मेरी चैनल पे बहुत सारे कंट्रीज़ के रिलेटेड वीडियोस मिलेंगे। आप चाहे यूके ले लो, कनाडा ले लो, या फिर स्विट्ज़रलैंड, न्यूजीलैंड और यूएसए और UAE, any country's specific requirements, opportunities, everything, you will get the knowledge on my channel. So you will get that. Pursuing masters from India is better than or abroad? Very good question. I really wanted to answer this question because, guys, if your future plan is to settle down in India, start your own clinic or something. Just give me 1 minute, guys. Yes. Yes. Just 2 minutes, guys. All right. Sorry for the interruption. So as I was saying, if your future, you are thinking to like work in India itself, then there is no need to spend much amount of money going to abroad and then coming back to India to work over here, because obviously you know that you will not make any contacts while you are doing master's degree in foreign countries specific to where you want to work. Plus you are going to spend more money just to do the master's degree, which most of the courses and specialization in foreign country, you will feel that you have already learned it in BPT. So I would not recommend that. But yes, if your future goal is to work in foreign country, that particular foreign country itself, then it is very much better if you go to that specific country and then you are just working over there. All right.
I just got to inspect your bed really quick.
Yeah, sure.
If you don't mind, I'm just going to spray around that. I got to pull
Yeah,
it out.
yeah.
Thank you. That's great. I'm just going to spray it and be all set.
Thank you.
Yeah, it's just a preventative because of the treatment I'm doing downstairs.
I understand.
So it's just in case.
Yeah.
All right, you're all
All
set.
right. Thank you. Thank you.
All right, all set. Take care.
The bags and everything.
Okay, so that was a long break. I'm going to start again. All right. So the first thing, already I told you guys that MPT in India or abroad. And if you're going to work in India, then definitely do MPT from India only. If you're going to work in abroad, do your MPT from abroad. Short and sweet. Let's not make it bigger. Let's go to the next question. Non-metro cities, yes, definitely good earning potential if you're really good at it. All right, if your skills are good. How is DPT different from BPT? So DPT has many definitions. I would say that DPT people consider like diploma in physiotherapy, or people also consider it doctorate in physical therapy. So if you are in countries like USA, there they tell it like doctorate in physical therapy. If you are in some other countries, there are some diploma courses also happening. So if you are doing diploma courses, I let me remind you that they are not valid in many of the countries nowadays according to the WCPT guidelines. So make sure you are either doing bachelor's in physiotherapy or you are doing doctorate in physical therapy but not diploma in physiotherapy. Of course, reading more books can help you guys. It's there is no never other option around. Which one is more recommended, doing BPT than moving abroad for MPT, or job or doing MPT and moving abroad? If your plan is to move abroad, then just go directly to abroad. Don't waste your time doing MPT over here and then going to the abroad. Okay, because time is the money. If you are wasting your 2 years, 2.5 years studying over here, then again if you have to study in foreign countries, you are going to waste more 2 years. Don't do that kind of thing. Directly go to the country, study over there, or directly start working over there. There are certain countries like let's say UAE where or UK where your BPT degree is still valid. Just you just need 2 years of experience. So gain those experience and you can directly start working over there. But yes, of course you have to look at the opportunities and if you have a job in your hand or not before going over there. uh, Other than DY Patil, GNDU as their entrance is done. Okay, so good sports physio MPT college. I cannot say any college names over here, but I would say that any college which has good exposure, like for you to have on-field physiotherapy training, those colleges should be good because you don't worry about like what you will learn in the MPT program over there, because most of the colleges faculties are not going to take your regular classes like properly. Teaching is not going to be there. It's all about like how you learn, how you conduct your own research thesis, as well as the most important thing is what all exposure like you get. That is what is most important. So if your exposure is good in the college, take admission in that college. Don't worry about any other things. What if you're not sure about future plan? Then take some time, take a break. There is always a good thing like, okay, right now I'm not sure what should I do. Take a 6 months, 1 year of break, start working somewhere as a physiotherapist, and then you just explore what are the things you like, dislike, and then you will gain some clarity. Okay, what should I do in future? Hmm. MPT in pediatrics, already discussed about it, Amal Raj. You can just go back a little bit and you can just listen about it. MPT worth it? Yes, definitely worth it. If somebody is telling that MPT is not worth it, I don't believe it, because it's very important that in current scenario you do master's degree. Doesn't matter you do it in physiotherapy or some other courses, but just get a master's degree if you want to sustain in the competition. Yes, you can pursue MBA. As I mentioned earlier, there are two options: masters in healthcare as well as public health. Masters in Germany. Yes, you have to learn German language. You already know about it, right? So you have to clear level B of German language to get admission in the Germany, and after that to practice as well in Germany. And it's a good option if you are willing to learn a new language. Pay scale is good. Job opportunities right now are there. I don't know about in future 2 3 years whether it will be there or not, but right now yes, it's there. Procedure for HCPC registration. I already have posted a specialized video on that. You can just go through that video and you will find all the details about it. What degrees would you say are available in Germany to become sports physiotherapist? They have a specific, again, exercise science as well as kinesiology, just like USA. Plus, they have also some sports specific courses, which are 1 year or 1.5 year of courses, which you can just look at them. Mm, my last exam of MPT tomorrow. What should I do next? Any guidance, sir? Well, you must have thought before taking admission in MPT that what you want to do after MPT, right? So I would suggest that first of all, after finishing your exam, take a break of 1 week or 10 days, and wait for the results. And once you get the results, before that, if you can just start planning whether you want to start your own clinic, you want to go in academics, or you want to study further, you continue research, or you want to go to some foreign countries, whatever requirement is there, just go through them and start preparing your plans. How to come back in clinical field, as the confidence is very low now because due to some personal reasons there is a gap occur in my career. In this scenario, I would suggest you to start reading your basics like anatomy as well as your biomechanics, and then slowly upgrading to the condition based books. And meanwhile, along with that, also you can start working under somebody who is already practicing physiotherapy and start seeing cases under observation or along with them, like accompanying them, so that you will gain some confidence. You will have the knowledge, basic knowledge, to diagnose the patient as well as to treat the patient. Once you are confident enough in 3 to 6 months, then you can have your own practice as a physical therapist over there. All right, so I think we have a little bit deviated from the topic, but there is no harm in answering a few questions here and there. So let's conclude this live session, guys, like by saying that the first point is yes, MPT should be done. You should not leave after bachelor's in physical therapy. Second thing is, if you are thinking of doing specialization MPT, think of a specialty on the basis of two things. The first thing is your interest, and second thing is what will be the future um, what do you say, opportunities in that particular specialization. So in this particular live session, I have mentioned about four specialties which can be futuristic, like I have mentioned about the women's health or OBGYN. I have mentioned about the pediatric sports. I have mentioned about the geriatrics, as well as other one which I have mentioned about is, how can I forget that? Okay, I have also mentioned about the AI in healthcare, and also there are various other options like MHA, MPH. You can do an MBA in sports management, and all these details again I have made a separate videos. You can just browse my channel and you will get all those videos. And other important thing, like whether to do MPT in India or foreign countries. So that, for that also I have answered very properly that you have heard. And again, I'll just conclude it that yes, if you are going to work in India, do masters in India. If you are going to work in foreign countries, it is better to directly go to the foreign country. And I've answered few of your questions. I'm sure that it's going to help you all um, too much. I'm going to answer a few more questions before leaving, so just stay there for 5-10 minutes more. I'm MPT neuro graduate trying for going foreign country. Is it needed a 2 years experience? Yes, if you're going to UAE or UK, 2 years experience is required. Doesn't matter you have done MPT, because you can either show your MPT degree or you can show your experience. It's up to you. That's a loophole I can just suggest you. Suppose I join a hospital as physiotherapist, especially as a cardio department. What all things other than physiotherapy syllabus should I learn? Well, you will need some basic knowledge about ICU specific equipments, like how the ventilator works, what are the basic things like volumes, capacities of lung, then what are just physiotherapy techniques, what we used to do, and some knowledge about like CPR is important. So all those things, if you have along with your physiotherapy knowledge, it's going to help. What are the procedure for MPT with jobs in Australia? Please guide. It's a very vast topic, but short and sweet, I can tell you that Australia MPT admissions are very difficult because they will ask your average score above 70 percentage to get admission in Australia. That's the first thing. Second thing is you have to clear APC exam. Once you clear the exam, then only you are eligible to apply for the jobs. And if you have cleared the exam, jobs are easy to get. Mm, I can suggest you, Archana Sharma, that you can start reading from the anatomy, BD Chaurasia, biomechanics, JSF, joint structure and function by Cynthia Norkin. And you can also start reading from David J. Maggie for special test and diagnosis. And later on, you can just, if you are ready, once you feel ready, then you can just go through the Suzano Sullivan for all the assessment related skills. So step by step go, don't just jump onto everything, go step by step. mm, okay, where do I get to know the first list of college available foreign countries? Sometimes they are mm, they have website something they have don't there's many sources where I can find college which provide masters in kinesiology. There are good colleges like I can say Brooklyn's, then there is what do you say this New York, some colleges are there, as well as Loma Linda in Loma Linda University is there. Then Texas, some universities are there. I would suggest directly just go to the Google and ask, or if you are using ChatGPT, even ChatGPT will help you with this. Strength and conditioning course as physiotherapist. Why you need? Because you are already a physiotherapist. You already have the knowledge about the basic physiology and exercise physiology. You don't need to do separate strength and conditioning course. But yes, if you are interested to become a strength and conditioning coach and you require certificates for that, go for it. What are the chances of getting part-time job as a physiotherapist while doing MSc physiotherapy in UK? Part-time jobs easy to get, nothing to worry. What are the procedure for MPT with off jobs? I already told you. Where do you live? Okay, currently I am not in India, but basically I live in India. Mm, I'm admitted in NILD Kolkata in 2025 for PPT. How is this college for job exposure? No idea. I have no idea about that. Um, Good college for MPT in Europe, please. Please guide me as well. Jobs for physiotherapy part time while doing MSc in UK. Can we do jobs and MPT together in Australia? Yes, you can do. All right, guys. So, sweetie, part-time jobs while doing MSc. I think if you are already studying over there, I think you are the best person to find part-time jobs over there. You can just connect with some of your colleagues or seniors or any known person who are already there in UK. They might be helping you better in compared to me telling you about part-time jobs available. All right, guys. So I think this is a fair and good live session. Thank you so much for actively participating in this. And soon we'll conduct more and more live sessions like this. And we'll talk more about the different topics in physiotherapy. And if you have any other topics like you want me to speak about specifically, please just let me know in the comment section so that I can work on those topics and help you understand better about those topics and guide you basically. So just comment down in the comment section and I'll be coming up with more and more live sessions. Thank you so much.